Now talk about the rapidly growing rate of breast cancer in India. In the year 2024, India witnessed 2.05 lakh breast cancer cases, up from about 1.292 lakh cases in 22-23. And as experts point out, the biggest enemy is lack of awareness. Today, we have a globally recognized healthcare fighter, Dr. P. Raghu Ram, who secured a Guinness World Record for hosting the largest audience at an AI-enabled holographic health awareness lecture. The event also launched NARI, a national initiative promoting breast health awareness. Dr. P. Raghu Ram, a renowned breast cancer surgeon, received the honor along with the Usha Lakshmi Breast Cancer Foundation and also the Kim's Usha Lakshmi Center for Breast Diseases. What makes this achievement even more significant is the fact that this is Dr. Ram's third Guinness World Record title in the last 15 months alone, all for AI-enabled holographic breast health education. So this is not just projects. Dr. Ram is also one of the greatest heroes of modern era healthcare transitions. Also highlights his continued efforts to leverage technology for public health education and breast cancer awareness. Let's quickly bring him in. Dr. Raghu Ram, thank you for joining us here on the Breakfast Club, and many congratulations on your third Guinness World Record in just 15 months. When you learnt about creating another world record, first up, tell us what was the very first thought that crossed your mind?
Gratitude, because gratitude is the best attitude to have. Gratitude to my parents and to the entire team, the technology partners, and to countless people who have made this possible. Last year, we secured 2 Guinness World Records for conducting the largest awareness session on breast health. And this year, it was utilizing artificial intelligence to reach out and create awareness. So I'm deeply indebted to everyone who has been involved in this program.
Speaking of which, Dr. Raghu Ram, holograms are typically seen as very sci-fi. You know, that's the first impression you get. How did a breast cancer awareness campaign end up using AI-powered holograms?
Yes, I'll try to be very brief, but there's a story to this. You know, I relocated to India in 2007 when my mother was diagnosed with breast cancer. And through a foundation established in her name, Usha Lakshmi Breast Cancer Foundation, we created awareness about various aspects relating to breast health, particularly breaking the taboo around the importance of early detection of breast cancer through a number of innovative ways between 2007 and 2017. And a decade later, in 2017, inspired by our Prime Minister's Digital India campaign, we launched the world's first mobile app on breast health, which actually helped to disseminate information about every aspect of breast health in English and 11 commonly spoken Indian languages. And 10 years down the line, 9 years down the line, in 2026, artificial intelligence has come up in a big way, and we are utilizing medicine, artificial intelligence, and immersive technology to be able to reach even further. So this is the next step in our mission, and that's what we've been able to achieve through artificial intelligence.
Dr. Raghu, what was the reaction from the audience? So tell us all about that experience. You must have witnessed it later on. The experience of the audience when they realized they were actually interacting with an AI version of you.
Absolutely. They were amazed and curious. And it was fascinating to see so many of them, because this hologram representation of me, which is artificial enabled, gave a 30-minute awareness lecture on benign non-cancer problems and breast cancer. So after the 30 minutes, there was questions in multiple languages, in English, Hindi, Telugu, and Tamil. And what amazed me is they were able to ask questions without any inhibitions. And that shows that, you know, artificial intelligence has the power to reach out in so many languages, because India is a diverse country, and that was a test to see how we are going to take this forward in future.
Dr. Raghu, you know, the other question that everyone's really going through is trying to answer lately is the merger of technology and healthcare. And you have often said that technology alone cannot save lives. Knowledge, early detection is what is the most crucial aspect to the entire detection story. Now, why was it important for you to combine healthcare with AI?
Yes, the answer is simple, because knowledge is power. And if one is armed with the knowledge that early detection saves lives, countless lives will be saved. Because in a country like India, because of lack of awareness, because of lack of knowledge, more than 60% present in the advanced stages. So if we can democratize accessible, evidence-based information into the public domain, then we hopefully will be able to save many lives through early detection. So artificial intelligence, hologram, and digital avatars are the way forward to ensure that this happens.
Dr. Raghu Ram, we often hear about AI replacing jobs. It's one conversation that we pick up every now and then, especially given the number of layoffs we're seeing, especially in the corporate sector. Your work shows AI helping save lives. Is healthcare one of the best examples of AI being a force for good?
Absolutely. AI is one of the best examples. Healthcare is one of the best examples to show that AI can be utilized and it can be a force multiplier. But I believe that AI should not replace doctors because AI is a technology tool, it's an educational tool, and it cannot replace compassion, it cannot replace empathy, it cannot replace clinical judgment and doctor-patient relationship, which actually can only be delivered by a human. So we must utilize technology to reach further. So when, as I mentioned, between 2007 and 2017, we created awareness by giving talks, awareness sessions. But now, with artificial intelligence and digital technology through a digital avatar and hologram, we are able to democratize the information and take it far and wide so that people will be empowered. And when they are empowered, hopefully they will present early. And when they present early, we can save scores of
Well, that's a
lives.
smart way of answering my question. What I was trying to ask you is whether, at least in your domain of the experience you've had, would you say, in terms of healthcare, that AI is a job enabler, not a job disruptor? Or would you say it really depends on which part of the world and which field are you talking about?
Okay, so if you're talking about awareness, this is what I've mentioned. But if you're talking about in my area, in across the world, to detect early detection, the mammography is the best way to pick up early cancers. Traditionally, a radiologist is involved in reading a mammogram and interpreting a mammogram. But there are many studies which show that with artificial intelligence, we are able to report mammograms very accurately, sometimes more accurately than a radiologist, particularly in a screening setting. And so, therefore, in certain areas, artificial intelligence will be very useful, but I think we should use it sensibly.